Cincinnati's largest employers is fighting its way back from a financial crisis that's gone mostly unreported. That is, until now. UC Health is a crucial part of the region's healthcare system right now because of the unique roles it plays for people who cannot afford to pay.
WCPO 9 I-Team reporter Dan Monk learned UC Health is close to finalizing a Medicaid deal, and that could bring it back to break even.
When UC Health physicians were helping to save the life of Buffalo Bills safety Damar Hamlin last year, UC Health itself was in critical condition financially. 15 months later, both patients are doing better.
While we're not out of the woods, we certainly are pleased with the progress we've made.
Corey Shaw became UC Health's CEO 7 days after Hamlin collapsed during a Monday night football game in Cincinnati. Hamlin was healthy enough to play again for the next season. UC Health's recovery is taking longer.
For patients that don't have as many choices, and certainly in urban Cincinnati, we're it, and we embrace that role.
Its financial woes were not widely known, but they were serious. UC Health posted operating losses of $256 million in the 2.5 years ending in December, depleting cash reserves and threatening its ability to deliver crucial services.
The next generation of medical students, nursing students, pharmacists, health sciences professionals, and all those unique disciplines were their primary teaching site. So about 100,000 patients come to our emergency departments of here and up at Westchester on an annual basis, and then in addition about 6,500 patients get transferred a year from other hospitals.
So it's too important to fail.
I'd agree. Yep, absolutely.
Will it fail?
No, it will not.
How do you know?
Yeah, so we've actually tackled a project here to try and restore the health system to a level of financial integrity that is going to allow us to thrive in the future.
Those changes include working with a consultant to eliminate about a third of UC Health's upper management jobs and renegotiate contracts with insurers. They also found ways to boost revenue with new surgery rooms and an expanded ER.
3 of the last 4 months, we've actually produced a positive operating margins.
But the biggest improvement came when Shaw convinced state lawmakers to require Ohio's Medicaid director to establish a hospital-directed payment program for UC Health. That's expected to bring $279 million in additional payments to UC Health by 2025.
Why not? I mean, University Hospital is the only level 1 trauma hospital in our area, and in many specialties, they are the only game in town.
State Representative Bill Seitz said the payment plan won't cost the state a dime.
It allowed them to use their own internally generated money at University Hospital, UC Health, to create the match that would draw down additional federal money.
Directed payment programs are growing in popularity because states see it as a way to boost Medicaid spending without raising taxes.
Public hospitals can transfer money to the state Medicaid program that then goes back to the hospitals with the federal match on top of it. So you can see how this can generate more and more spending.
Ray Hederman from the Buckeye Institute says it's one reason Medicaid spending grew by 10% coming out of the pandemic.
Taxpayers have to pay for Medicaid program either at the state through state level taxations or at the federal government through federal tax dollars.
UC Health would be the 5th Ohio healthcare provider to get a directed payment deal. Shaw argues it's justified by UC's unique role as a safety net provider.
Everyone understands that what we do is essential and that we can't be irresponsible about our price and our cost structure, but at the same time, you've got to make an investment to ensure that what we do is available not only today, but over the next decade.
In Corryville, Dan Monk, WCPO 9 I-Team.